All right, welcome back. Hope we're all having a great week. Today we're continuing our Let's Learn ABA series with prompts and prompting. Prompts, prompting, crucial skills for both RBTs and BCBAs, not only in service delivery, but also in your exam. You have to know them, you have to know the types, and you have to know how they're used. Today we're going to cover all of the above. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. If you're looking for RBT study materials, please check out btexamreview.com. For BCBA study materials, check out behavioranalyststudy.com. Those links will be in the comments below. We also have a join button now on YouTube if you'd like to support us further in a YouTube membership. Other than that, let's keep working hard, keep studying hard. Let's learn ABA. First, our introduction slide, real quick summary. We're talking about prompts. Antecedent stimuli used to evoke a correct response. Remember, prompts are antecedents. They occur before the response. They become temporary SDs because they temporarily are going to evoke the behavior. Later on, we're going to fade out the prompts. We're going to transfer stimulus control to our actual SDs. We have response prompts that act directly on our responses. And then we have stimulus prompts that act on the antecedent stimuli. And we're going to talk about fading, most to least to most, graduated guidance, and time delay. So let's start with using prompts. Again, a prompt is just an antecedent stimulus used to evoke a response. Whenever you're teaching a new skill or when you want a learner to do something and they're not doing it in the presence of the SD, that's when we prompt. We use temporary arranged SDs to evoke the response we want to see. Because when we get to the prompt, when we get to the response we want to see, we can deliver reinforcement. Later on, we fade the prompt. That's how we teach. So we have response prompts. They act on the response directly. These are verbal, modeling, physical. Physical prompts, usually the most intrusive. Verbal, much less so. Then we have stimulus prompts. They operate directly on the antecedent stimuli. Understand the difference between the two. We have movement, also known as gestural. We have positional, and we have redundancy. Go through each one of those. Question. Rearrange a field of 3 cards so the correct answer is closest to the learner would represent a what? Very common method of prompting used a lot of times with our younger learners. We have fields of 3 and fields of 5. We'll move our cards and our stimuli around. We'll move the correct one closer so we can get that direct response. And this one's pretty easy. If you're changing around the card and you're moving it, what are you doing? Well, you are changing its position. This is going to be a positional prompt. Now, redundancy, it's not physical, it's not verbal. And remember, movement is really just a gestural, right? We're pointing at something, we're gesturing towards something. If we're actually moving the stimuli around, that's a positional prompt. So, response prompts, we act directly on the response here. Okay, we are acting directly on the response we want to see. We're not changing the stimulus or the antecedent stimulus, we're focused on the response. Verbal prompts occur frequently in verbal instruction. So we're telling someone to do something, right? You can say, go wash your hands, and then your prompt might be in the sink, and they get up and go into the sink. Non-vocal instruction as well. Remember, just because it's non-vocal doesn't make it verbal. So non-vocal instructions like written words, pictures also qualify as verbal prompts. Modeling is very easy and practical. You can be very successful with modeling because with modeling, it is highly intrusive. You're showing the learner exactly what you want them to do. The example they use in the book is how to pass a basketball, right? So you can model holding it over your head, and the learner just has to hold it over their head. It's easy, it's practical, it's effective. However, there are stipulations. With modeling, the learner has to attend, they have to watch the model, and they have to imitate. They don't have attending skills, they don't have imitation skills. Modeling is not going to be very effective. So be careful and do your assessments. And then finally, physical, the most intrusive prompt we have. Partially, okay, or fully guide the student's movements through the response, right? So we have partial physical, we have full physical. Most intrusive, you have to be ethical here. Now, why is that? Let's look at our question. Why might it be unethical to use a physical prompt with the client? Well, how about A, many clients resist physical touch? Sure. A lot of clients don't like to be touched. A lot of people don't like to be touched. A lot of clients might have a history of abuse. You don't know the situation. If they resist the physical touch, then you need to alter what you're doing. Don't force them to just like physical prompting. Okay. B, it does not allow clients to perform the behavior themselves. This is a big issue with physical prompting. It really promotes prompt dependency. If I'm always hand over handing and doing it for them, it never gives them an opportunity to just do it for themselves. C, stakeholders might not like physical prompts. A lot of stakeholders are aversive to physical prompting, especially if they have poor experiences in the past with ABA companies or schools. So you might have to sit down and have a discussion if you're the BCBA and a talk with them. If they are adamantly against physical prompting, that is their right, that is their choice. We need to be ethical, got to find a different way. So, which one of these is right? Well, many clients do resist physical touch. It doesn't allow clients to perform the behavior themselves, and some stakeholders might not like physical prompts. So what might be unethical about a physical prompt is, well, all the above. Let's talk about stimulus prompts. We're acting on the antecedent stimulus. So now we're actually manipulating whatever the antecedent stimulus is that's evoking the response. The easiest way to think about these is think about picture cards, okay, fields of three. Not acting on pointing and we're not physically guiding, we're not telling them what to do and modeling. We're looking and pointing at the stimuli, we're adjusting the stimuli, right? Understand the difference between the response prompt and the stimulus prompt and what we're manipulating. So we have a movement prompt, which is just a gestural prompt. I'm pointing to cards. I'm tapping cards. I'm touching cards. I might be looking at cards. A lot of inadvertent prompts have to do with gestural and movement prompts, right? You give an SD, touch the red, and you accidentally look at red. A lot of kids are very savvy and they'll pick up on that. We need to be careful with our movement and our gestural prompts, right? Because we can really inadvertently prompt. Now, again, if I have a field of three, I'm tapping the stimuli I want them to choose. That's a movement prompt. Positional. We can move that stimulus card, right, around and closer to the learner, maybe into its own side of the table. We're making it very clear that this is the stimulus we want them to choose or not to choose. That's a positional prompt. And then a redundancy prompt. We're pairing a feature, a color, size, and shape with the correct choice. So you're changing the color of the stimulus, and then you're pairing that color with the right response. So, of the following, what is the most intrusive prompt? A movement prompt, a positional prompt, a modeling prompt, or a verbal prompt? So, in general, your hierarchy is always going to start with our full physicals and our partial physicals, go into modeling, and then go down from there. Okay, modeling, although not physical, is extremely intrusive. Stimulus prompts, much less intrusive because you're not actually acting on the response, right? You're just adjusting the antecedent stimulus. Transferring stimulus control. I always get the question, what is transferring stimulus control? I don't understand it. Don't overcomplicate it. When we're transferring stimulus control, all that means is we're fading the prompt. That's all it is, right? We're transferring stimulus control from our temporary SD to our actual SD. So let's look at the different ways. First, most to least. Most to least, we're beginning with the most intrusive prompt, which is physical guidance, and then slowly reducing the intrusiveness of the prompt. So when using most to least, start with physical guidance. See what happens. See if it works. And then slowly, as necessary, fade that out, right? And reduce. The typical order is a physical prompt to a visual prompt to a verbal prompt. Now remember, we need to individualize, so this might not be across the board, but that is the typical hierarchy. I start physical, then I move to visual, then I go to verbal. Least of prompts, the exact opposite. First, you give the opportunity to respond without prompt. We're trying to see, can we do this without prompting? If not, we present the least amount of prompt as needed and slowly build up. Don't least to most prompting. Don't use least to most prompting, I should say, by giving the opportunity to respond without prompt and then immediately jumping to physical guidance. Not what we're trying to do. So think about it this way. If our most to least hierarchy is physical, visual, verbal, our least to most hierarchy is going to be verbal, visual, physical. And that's the order you should try to go in, right? With least to most prompting, we're really trying to eliminate the need for these very intrusive prompts. So what are some of our guidelines? One, most to least should be the default technique when you don't know the learner's history. So if you know nothing about the learner, you don't know how they learn, what they know, start most to least, right? Full physical. And it might surprise you. You might see, okay, they're quick learners. I don't need it. That is the judgment we have to make. 2, if errors are common, most to least. Remember, the issue with errors is they lead to more errors. And if you're teaching with errors present, they become part of our behavior chains. We're trying to eliminate errors. Most to least, full physical is a great way to eliminate errors. 3, least to most might be best for quick learners. If you've got a quick learner, they don't need physical prompting, right? Maybe a simple movement prompt or redundancy prompt, right? Or a positional prompt, a simple stimuli prompt might be enough to teach them. Least to most could be best for quick learners. 4, always monitor progress and adjust for errors. That goes for everything. That should be a general guideline statement. Monitor progress, adjust for errors. 2 more, graduated guidance. You're providing physical prompts, but fade out immediately. Remember, graduated guidance is a form of physical prompting. Okay. What we're doing here is we're starting by not touching the client. We might just be near the client's elbows, near the client in general. As we watch them attempt the activity or the response, we slowly incorporate physical guidance only as needed. And then what do? We remove it immediately. Think about that idea of graduated guidance. Gradually increasing the amount of guidance I'm giving and then fading immediately. And then time delay, it's considered errorless learning because with time delay, you first present the prompt and target first. So errorless learning, right? Here's your target, here's your prompt. I'm not going to allow you to get it wrong. Slowly, I introduce a time delay between the SD and the prompt, right? So in the beginning, I might say touch blue, and then immediately I gesture to blue. Okay. And then next, I'm going to say touch blue, wait 3 seconds, and then gesture. The idea is we're trying to increase the time in between prompts until the client can just do it independently. So what are the big 4? Most to least to most, graduated guidance, time delay. Wrapping up, that's all there is to it. Let's not make this stuff complicated, okay? People overcomplicate it too much. Don't need to do that. Prompt is an antecedent stimuli used to evoke a correct response. They become temporary SDs, and then we fade them out. Response prompts act on the response themselves, physical, modeling. Stimulus prompt acts on the stimuli, movement, positional, and then we fade. Least to most, graduated guidance, and time delay. Fantastic. We have learned ABA. Great work, everybody. Be sure to check out btexamreview.com and behavioranalyststudy.com for all of our study materials. Questions, comments, let us know. Like, subscribe, work hard, study hard. See you soon.